The number of people infected with the coronavirus in South Africa has now risen to 927. As the cases increase, health professionals will be on the front line. The Health Professionals Council has appealed to medical professionals to carry out their duty with integrity, while South Africans are urged to go for testing when they suspect that they might have been infected with the deadly virus. To understand this virus a little bit more, we are now joined via Skype by Professor of Vaccinology at Wits University Shabir Madhi. Good evening, Professor, and welcome to this special broadcast. First of all, as the country counts down to this particular lockdown, I'm sure a lot of anxieties as well. And as we move into the cold season as well, lots of people may be thinking that because I have this cough or this mild cough, I could be infected with this virus. What's your advice to them?
Right. So I think good evening to you. And I think you raise a very important point in that this is a time of the year when there's a number of other viruses which start circulating. As an example, right now, the virus that is circulating is known as respiratory syncytial virus, which comes each year. And that is usually followed by influenza virus. But that being said, unfortunately, because of the circumstances that exist currently in the country in terms of the community-wide spread of the SARS coronavirus 2 or COVID-19, we need to have a heightened index of suspicion in terms of going forward for testing. And the recommendation really would be anyone that's got a fever, that's got a cough, or starts having the other symptoms, which are sort of the flu-like symptoms, a headache, feeling tired, lethargic, they need to somehow go for testing. A lockdown on its own is not going to get rid of the virus. The reason for the lockdown is basically to limit movement of people, so those individuals that are infected don't end up infecting other people in the community, but rather they contain in a specific premises. And when they become infected, when they become symptomatic, they need to be investigated at an early stage. And it's only coupled with the investigation of symptomatic individuals that this lockdown is going to be successful.
We've also heard from the WHO saying that testing is very important to try and contain the spread of the virus. And there were some suggestions, at least, that even the military should be assisting in trying to screen people who may be infected with the virus. Do you think that that's a wise idea, as the military will be patrolling the streets of the country and trying to enforce the regulations as well as the rules that have been put in place under the president's decision to put the country under lockdown?
Yeah, so I think the reality is in the context of a lockdown, the military can't go knocking door to door in terms of trying to identify which individuals are actually symptomatic, which individuals have got a fever, and who should actually submit themselves to testing. So the reality is that it's not something which the military is going to do because the people are simply not on the streets. So it's really going to become, it really needs to become the responsibility of every individual, especially in those areas where there's a high amount of number of cases. And that is in Johannesburg, that is in the Western Cape, in Cape Town, that is in KwaZulu-Natal. In those areas where individuals are becoming symptomatic, they need to make plans to get tested as early as possible, even whilst they're in the lockdown. Like I said, the lockdown itself is not the solution. It's part of the solution, which is only going to succeed if we're able to identify individuals at an early stage of the illness.
And let's speak quickly about the medical practitioners and those who will be doing some of these screenings at the various posts that they will be deployed to. What is it that they should be taking into consideration, considering as well that yesterday we heard that at least 2 or 3 of the medical staff that have been working on the coronavirus and also screening people have been tested positive?
Yeah, so I think the reality for medical practitioners and all healthcare workers that are at a cold face in terms of coming across individuals that are symptomatic is they need to take the necessary precautions, and they need to be equipped with the proper gear to take the necessary precautions to prevent themselves from becoming infected. The reality of this virus is that healthcare workers, unfortunately, are at a much heightened risk than the general population in terms of becoming infected. So what do healthcare workers need to do? They need to be equipped. They need to be provided with the necessary protective sort of equipment, including a mask, including goggles, including gowns, to be even just at a time of actually investigating an individual, let alone actually taking care of the individual. When they need to take care of someone that's infected, there even needs to be a greater heightened level of protection, which they need to be equipped with to avoid our medical workforce from becoming infected.
What about those private medical practitioners who have assistants that they work with? What is it that they should be doing?
Right. So I think it's really important that what the community needs to do, what society needs to do, is that when they're presenting to a hospital, when they're presenting to a general practitioner, before they enter the door, ideally, they should actually call in to let them know what sort of symptoms they've got, especially if they've got these respiratory symptoms. And it might well be that they don't necessarily need to go to a general practitioner. They might be referred directly for testing to sort of avoid infecting that particular premises. There might be other individuals that are sick in that premises who are at risk of being infected by this person with a respiratory illness coming into that premises. So what is really being promoted at the moment is what is called telephonic consults. And I think people need to make use of that sort of a facility both in the private sector, and it needs to be rolled out in the public sector as well to some extent, where people are given the necessary advice in terms of what to do when they become symptomatic, rather than rushing forward to clinics and to hospitals, which could aggravate the problem.
Professor, I know that in South Africa currently as it stands, we don't have any case of somebody dying from the coronavirus. But what I've noticed, what's currently happening in Iran as well, is that there has been a debate that's been going on around what do you do with the body of somebody who has been infected with the virus? Could the virus spread even though the person has passed on?
So I think the reality of this virus is that what we do know about it in terms of how long it survives in different sort of surfaces, the virus can survive up to 3 days. And that's the reality. And certainly someone that has demise of the virus is not really dependent on that individual to survive, because a virus, in fact, is not a living organism for all intents and purposes. So the virus itself can actually continue sort of, in a sense, surviving in the body. So you need to be careful in terms of how that body is handled. So it's really going to be important. We need to be extremely cautious. We need to try to get the burial process expedited with a minimal amount of contact with the body by the families.
Okay, then thank you so much. That is Professor of Vaccinology at the University of Witwatersrand, Professor Shabir Madhi.